A 45-year-old male with COPD presents to the hospital with an exacerbation of his lung condition. He is in respiratory distress and the physician recommends he sit leaning forward. What is the purpose of sitting like this? A. To prevent falling. B. To help inhale air. C. To prevent loss of consciousness. D. To easily cough out secretions. E. To help exhale air. The answer is E. To help exhale air. COPD is a chronic lung condition marked by air trapping. Patients with COPD are instructed to sit in the tripod position to help them exhale air. Patients sit and lean forward to help maximize air exiting from the lungs. Which of the following best describes the mechanism of albuterol inhalers during an asthma exacerbation? A. Alpha-adrenergic antagonist. B. Beta-adrenergic antagonist. C. Beta-adrenergic agonist. D. Alpha-adrenergic agonist. E. None of these. The answer is C. Beta-adrenergic agonist. Albuterol is a beta-adrenergic agonist. It helps to open up the airways during an asthma exacerbation by activating the beta-adrenergic receptors, part of the sympathetic nervous system. Side effects include increased heart rate. What is the inspiratory reserve volume? A. The amount of air that can be exhaled after normal inhalation. B. The amount of air that can be inhaled after normal inhalation. C. The amount of air available in the lungs after exhalation. D. The normal amount of air that is inhaled with each breath. E. The total amount of air the lung can contain. The answer is B. The amount of air that can be inhaled after normal inhalation. The inspiratory reserve volume for the average adult is roughly 3,100 milliliters. It is tested using pulmonary function tests. The inspiratory reserve volume is the amount of air able to be inhaled after a regular inhalation. This is in contrast to the expiratory reserve volume, which is the amount of air that can be exhaled after a regular exhalation. Which of the following side effects would you most likely expect when providing an asthmatic patient with continuous nebulizer therapy? A. Bradycardia. B. Hypothermia. C. Tachycardia. D. Pinpoint pupils. E. Hypothermia. The answer is C. Tachycardia. Asthma is treated with albuterol. This drug is a beta-2 agonist, which works to relax smooth muscle in the lungs, and open up the airways. A consequence of this drug is the beta-2 effects on the heart. Beta-2 on the heart causes an increase in heart rate, tachycardia, and is a common side effect seen in the treatment of asthmatics. You are a pulmonology nurse taking care of a patient who complains of episodic wheezing. You perform a diagnostic test in which you perform pulmonary function tests on the patient before, and after administering albuterol, a beta-2 adrenergic agonist. You note that the patient's symptoms and FEV1 readings improve drastically with bronchodilator administration. Based upon these findings, the patient most likely has which of the following? A. Lung cancer. B. Chronic obstructive pulmonary disease. C. Sarcoidosis. D. Asthma. E. Throat cancer. The answer is D. Asthma. Asthma is an inflammatory airway condition that is characteristically improved symptomatically and quantitatively, in terms of pulmonary function tests, including FEV1 readings, with bronchodilator administration, for example albuterol, the beta-2 adrenergic agonist administered in this patient. In this patient who presented for evaluation of wheezing, a characteristic symptom of asthma, his substantial response to bronchodilator administration makes the likelihood of an asthma diagnosis very high. Chronic obstructive pulmonary disease, COPD, is an obstructive physiology of the airways often due to chronic tobacco smoking. While bronchodilators may be of some clinical value in these patients, their FEV1 readings characteristically do not correct after bronchodilator administration, as this is a major method in which COPD can be distinguished from asthma and other inflammatory airway conditions. Sarcoidosis, lung cancer, and throat cancer symptoms would not necessarily improve with bronchodilator administration, nor would pulmonary function test readings in patients with these conditions. A 45-year-old obese male with a history of obstructive sleep apnea, hypertension, diabetes, and coronary artery disease presents to your primary care clinic for help in managing his fatigue due to his sleep apnea. He is not a candidate for tonsillectomy and adoidectomy. Which of the following interventions would be the best recommendation to treat his obstructive sleep apnea? A. Continuous positive airway pressure mask, CPAP. B. Metoprolol. C. Insulin. D. Metformin. E. Tamsulosin. The answer is A. Continuous positive airway pressure mask, CPAP. CPAP mask helps to force airway into the lungs that is otherwise obstructed by the patient's oropharyngeal anatomy as standard breathing pressures due to obstructive sleep apnea. When wearing a CPAP mask, typically when sleeping, snoring is reduced, and oxygenation is improved, allowing patients to have a more restful sleep and feel less fatigued the following day, while medications like metoprolol, insulin, and metformin may be beneficial to the patient in treating his conditions comorbid to obstructive sleep apnea, they do not have a direct effect on treating his sleep apnea or the resultant fatigue. Tamsulosin is an alpha-adrenergic blocker and can be used to treat benign prostatic hyperplasia among other conditions, but not obstructive sleep apnea. Which of the following best describes a diagnosis of uncomplicated or simple silicosis? A. Silica in the bloodstream but no clinical symptoms. B. Mild ventilation restriction and fibrosis on chest X-ray. C. Normal pulmonary function but shortness of breath. D. Massive pulmonary fibrosis visible on chest X-ray, but no extrapulmonary symptoms. The answer is B. Mild ventilation restriction and fibrosis on chest X-ray. Simple silicosis results in mild ventilation restriction and fibrosis on chest X-ray. Simple silicosis often results from long-term exposure to relatively low concentrations of silica dust, where symptoms usually appear 10 to 30 years after exposure. A 63-year-old female client is newly admitted to the hospital for pneumococcal pneumonia. The nurse recognizes that this patient will most likely exhibit certain symptoms associated with this condition. Which clinical findings are most commonly consistent with pneumococcal pneumonia? A. Headache, muscle aches, and a cough with frothy pink sputum. B. Slow onset of cough, nasal congestion, sore throat, and fever. C. Fever, chills, and a non-productive cough. D. Sudden onset of fever, chills, with a productive cough with rust-colored sputum. E. Dry cough with fatigue, nausea and vomiting. The answer is D. sudden onset of fever, chills, with a productive cough with rust-colored sputum. Pneumococcal, bacterial, pneumonia typically presents with an abrupt onset of fever, shaking chills, and a productive cough, usually rust in color. Usually viral pneumonias will present with a dry non-productive cough and associated with other viral infections. What population is most at risk during pertussis infection? A. Infants. B. Adolescents. C. Pregnant women. D. Elderly. The answer is A. Infants. Due to their susceptibility to suffocation, infants are more at risk of mortality than older children, pregnant women, or the elderly during pertussis infection. Mortality in infants with this condition can be as high as 2%. There is also an increase in infant comorbidities such as pneumonia, encephalopathy, seizures, and failure to thrive. You are the nurse taking care of a 78-year-old man with a 60-pack year smoking history who is hospitalized for shortness of breath. You review the X-ray and notice a 1 cm solitary pulmonary nodule within the middle lobe of the right lung. Which of the following is the most appropriate next step? A. Attempt to obtain and review a prior X-ray. B. Refer the patient for surgical excision of the nodule. C. Arrange for biopsy of the nodule. D. Administer radiotherapy to the pulmonary nodule. E. Administer chemotherapy. The answer is A. Attempt to obtain and review a prior X-ray. While the patient appears to have a very concerning story for a primary lung neoplasm given his age and smoking history, or a metastasis from another neoplasm, if this nodule was noted on a prior X-ray, especially a much older X-ray, and is unchanged, then the degree of concern about the nodule is much lower, given its stability over time. On the contrary, if you can obtain a recent prior X-ray and the nodule is not present on that scan, or has grown since that scan, then the level of concern about the nodule should be greater, and should guide clinical decision-making as such. Measures such as biopsy, surgery, chemotherapy, or radiotherapy administration are all possible future steps if indeed this pulmonary nodule turns out to be a malignant neoplasm. That being said, there is no definite evidence at this time that the patient's nodule is of malignant origin. And should this nodule be something that has been stable on prior X-rays for multiple of years, then the level of concern should be far lower, and the need for more invasive measures would be obviated.